incredibly important topic to cover with our young people at our schools, but also can be quite daunting for staff. So not to say you would present this whole thing to them, but it might be you pick and choose some bits that are relevant in your context. So what are the goals of this session then? As I've already mentioned, the briefing uses materials produced by the DfE with some support put in by Lead Equate. These slides are available for you. I'll make sure the link gets sent over, and they are a real good resource for upskilling our staff. But the goal is to explore how the outcomes in the new RSHE guidance can be broken down to provide appropriate learning for different age groups, to understand the key knowledge in this particular aspect of the new framework, to signpost the good practice and resources, to consider strategies for dealing with tricky questions, which of course in this topic maybe is more important than any other, although any aspect of PSHE you can come across tricky questions. And then finally, to feel more confident teaching about intimate relationships and sexual health. For those who have recently joined, please feel free, if you have a question at any point, if you want something clarifying, if you're brave enough, shout out. If not, chuck it in the chat or put your virtual hand up is absolutely fine. So I just thought it'd be nice to start with some statistics, I guess, of why it's so important to, and these are just a few, the ones that I found the quickest, I guess. A reason why it's so important to cover this in our PSHE program, intimate relationships and sexual health. The average age of puberty for girls in the UK is 12 to 13, and it's 13 to 14 for boys, so right in the middle of secondary school. The average age of sexual debut in the UK is 16 to 17. So again, that's sort of year 11, year 12 age group students we are working with. While most young people nowadays have not had sexual intercourse by the time they turn 16, so the majority haven't, but a third and a half have, according to NHS Borders. Additionally, according to NICE guidelines, there's strong evidence that where young people do not believe a service to be confidential, they will not use the service and may come to significant harm as a result. And that was particularly in light of contraception. So thinking about the use of contraception, and if a young person doesn't feel their request or their conversation or their concern is confidential, they won't ask, creating bigger issues for them. Again, highlighting the importance of what we do in teaching about these things. Conception in women under 18 has fallen by 60% between 1998 and 2016. However, the rate of conception in women between 15 to 17 is still 18.8 per thousand as an average across the UK. And the final statistic linking to the relevance of this subject for our young people at our schools, 420,000 new diagnoses of STIs in 2017, and 50% of those were in people under the age of 25. Again, highlighting the importance of good sexual health and education for our young people. And at the bottom is just the reference of where those statistics have come from. So I'm going to jump you straight into a breakout room. It is a weird doing training over Zoom. You're all there, but I can't see any of you or hear any of you. So I think it's important that we stay engaged. And so I'm going to put you into a breakout room, and I want you to answer this question for me. Okay, so just a 3 or 4 minute discussion. There'll be 3 or 4 of you in a group. Say hello, say your name, where you're from. And then I would just like you to have a quick think, coming up with 2 or 3 ideas. What skills and knowledge do young people need in relation to intimate and sexual relationships, including sexual health? So just thinking about what are the skills we're hoping to give our young people at our school. So just a 3 or 4 minute discussion, say hello, and then answer that question. For those who just joined, welcome. I'm chucking you straight in a breakout room to discuss this question. So if you'd like to join a room, I'll call you back in 3 or 4 minutes and we will get going after a little bit of feedback.
That's it, gone again. Well, that was strange. There were 3 of us on and only me and one other teacher talking.
Hello, welcome back. Anyone brave enough to share any thoughts you had about the knowledge that our students might need?
I think a lot of it's to do with empowerment, empowering them to make the decisions, whatever decisions they want, but it's giving them the knowledge and the power to make that decision themselves and confidence in that decision.
Yeah, fantastic. I'd summarize that as, informed choice. They've been given the information, the knowledge they need to be able to make informed choice in their intimate relationships. Thank you very much. Anyone else? Just take 1 or 2 more if you don't mind.
We talked about what merits consent and sexual health.
Perfect, thank you. I've had just a couple in the chat as well. So puberty and body changes, where they might get advice from. So signposting, consent, contraception, healthy versus unhealthy relationships, making links to LGBTQ and being inclusive, what language we use. So lots and lots of stuff in there. I think what it's highlighting is, I guess, the vastness of what students need to take away from their sexual health education here at school. And so I guess and I know I'm preaching to the converted in many ways, that's why you're here, but it's just, I guess, reminding us of the significance of this for young people as they grow up and they have intimate relationships. It's, of course, the primary learning will take place in the home, but schools do play a big part in educating young people. Okay, I'm going to share my screen again and keep going. Welcome to those who have just joined. We've done a bit of an overview and a little bit of a breakout room, and we are carrying on. So thinking about the new curriculum then and the new statutory requirements, the topics I think is always important for us to consider. How does this link to other aspects of the framework and the statutory requirements? So it's closely related to the science curriculum, as well as other topics within the new RSHE statutory requirements, like respectful relationships, being safe, changing adolescent body, mental well-being, health and prevention. Therefore, it's encouraged to consider thematic links across key topics and the whole school when planning and delivering lessons. I think it's really significant that we find ways to link knowledge and vocabulary across topics. So I know at my school, before we began the process of auditing our current PSHE delivery program to ensure it was in line with the new requirements and new policy and those sorts of things, I did an audit across the different subject specialisms, and particularly thinking about science and how we can marry our teaching in PSHE with what's happening in the science curriculum. So I think that whole school approach is significant. So last question in breakout rooms for a little while. Do be brave and speak up and discuss ideas. But I would like you to consider just briefly, and then I'm going to go into, I guess, the briefing part of this, where I'm going to present quite a bit of information. So you're going to go into breakout rooms again for 3 or 4 minutes, and I'd like you to ask the question, what support does your school offer in relation to intimate and sexual relationships, including sexual health? So it's just, I guess, thinking about the broader picture of our role as a school community in ensuring that we offer support to our young people. So where do they get that support? I've put a few ideas at the bottom there that you might be worth considering and thrashing out as you discuss. I won't go through them, they're there for you to view. So I'm going to stop sharing. I'm going to put you in breakout rooms just once more for a few minutes to discuss that question. Okay, welcome back. I'm going to jump straight back into the presentation just with time. I do hope that those conversations with colleagues and professionals is helping us consider, I guess, the wider role of our sexual health and intimate relationships education. Where's that gone? Sorry, I'm just sharing my screen. Multitasking was never my strength. And considering actually the role that other aspects of school play in ensuring we have a really robust and well-rounded sexual health and intimate relationships program. So moving forward then, we're going to whiz through some information and hopefully this is helpful for you in preparing to begin to teach the new framework. So from September 2020, this is the guidance. Hopefully you know that's been extended until the summer term. Schools have to have a regard to the new statutory guidance for teaching relationships and sex education. And like someone said already, this kind of summarises, I guess, why this is important. The aim of RSHE is to give young people the information they need to help them develop healthy, nurturing relationships of all kinds, not just relationships. Knowledge about safer sex and sexual health remains important to ensure that young people are equipped to make safe, informed and healthy choices as they progress through adult life. That's taken straight from the guidance. And I think there's nothing more important when it comes to helping young people become healthy citizens in society. And so we do play a really key role in those delivering and leading on PSHE and RSE. Something to consider, the guidance says we should consider, I'm not going to read all of this, these slides will be made available to you, so I'm going to whiz through quite quickly. If there is something you want to stop me on, feel free to jump in, but we need to consider the progression from primary relationships to secondary relationships, and that might be in your context. You might have a really good relationship with your feeder schools, and that can be an audit you do or a conversation to enable you to ensure that your program follows on from primary schools. And there is within the framework flexibility to design and plan an age-appropriate subject content based on the statutory guidance. I don't think healthy sex education, intimate relationships would look the same in every school context. And I think that's important to consider as you're planning something for your school, considering, do we buy in a package? Do we, you know, get a group in to deliver that teaching? Actually, I think those things are helpful, but it's also important to consider your own context. So it's always important to ground our teaching in and our education in sexual health and intimate relationships in healthy relationships, the characteristics of what makes a healthy relationship, because when young people understand that, they are far better equipped to establish and maintain good relationships, to identify unacceptable behaviour in relationships, and to understand what they can do to protect themselves and their sexual partners. So everything should be grounded in the idea of healthy relationships. It's really important we consider our inclusion needs. So first and foremost, that's in light of LGBT content. It's really important that we don't teach about LGBT issues as one-off examples, but they should be embedded into our program when we are teaching about relationships. So that's the use of inclusive language, considering different role models and examples, and also considering our own context and how individual pupils may relate to particular topics. And that might be individual pupils you're aware of, or a generalized understanding of the different relationships that will be present within your classroom. It's also, when we're thinking about inclusion, we do need to consider faith backgrounds as well of pupils, that they're taken into account when planning the teachings so that topics are appropriately handled. Not that we avoid topics or cut them out because it potentially might cause offence. It's really important we cover the whole curriculum. However, we must handle the content appropriately and sensitively, and I think best practice is always ensuring that parents and families and communities are well informed with what we're teaching and why we're teaching it. And I think when that happens, you're much less likely to have a hostile response from families and the community. Finally, the final aspect on inclusion is pupils with SEND. It's really important that we plan lessons to allow all pupils to access and practice the core knowledge. Okay, that's for most schools and academies, that's using your normal teacher expertise and differentiation. However, for some schools, there might need to be an adjusted curriculum depending on need. It's also important that you as a school or a trust or an academy have considered the statutory guidance around a right to withdraw. It says in the guidance, parents have the right to request that the child be withdrawn from some or all of the sex education delivered as part of statutory RSE. And so this is the only part of the curriculum that parents and carers have a right to withdrawal. And this training, just so you're aware, doesn't cover what parents can or can't withdraw from or what you as a school should decide. It's really important that schools refer to the statutory guidance in deciding what students can be withdrawn from. And I think that's something that's worth working out with your school or your trust to ensure it's in place before, and hopefully it won't happen, but before a parent requests to withdraw, that it's really clear on your website or in your policy, and that parents are aware what they can and can't withdraw from. Teacher wellbeing, again, inclusion, it's important that teacher wellbeing is considered because some of the content that is being discussed is sensitive. Okay, safeguarding when it comes to sexual relationships and sexual health, more than any other subject in PSHE and more than any other topic within RSHE, sexual relationships is the one where potentially safeguarding issues may arise. And I think it's good practice to let your designated safeguarding lead or any relevant staff, pastoral leads, support staff, know what you are teaching and when it comes to teaching these sensitive issues around sexual health and intimate relationships. Those staff might have information on students who may be affected disproportionately by discussing some of these issues, and they can, because of their own experiences or trauma, and then they can work to ensure that those students can access it or at least are made aware of what's coming up. Okay, it's really important that those delivering these lessons, your teaching staff are aware that disclosures are common and how to deal with that according to your school policy. In all RSHE, but particularly when it comes to sensitive topics like this, it's really important that ground rules are discussed. So they're not just presented, but they're discussed, they're really clear, they're modelled by the teacher, that they are followed consistently and referred to consistently, and that they're visible in lessons so that students feel safe at raising concerns. I think it's really significant that we create a safe environment so students can disclose, they can share, and they can feel comfortable talking about things which for many people are really quite private. I won't go over those. Ground rules are an integral part of RSHE delivery. Okay, a lot of information there as you sort of, I guess, the things you think about in preparation for the teaching. And now we're going to consider for the second half of this session, exactly what is included in the content of intimate and sexual relationships, including sexual health. So this is a whistle-stop tour. I'll try and get through it all, but I can't guarantee it because there is a heck of a lot. So the subjects covered, again, if we don't get through it all, in this aspect of the statutory requirements is healthy intimate relationships, sexual consent and the law, identifying and managing sexual pressure, sexual relationships, human fertility and reproduction, pregnancy choices and support, STIs, and contraception and sexual health advice. I actually, when looking at these slides, thinking, oh, how can I guess, save a bit of time? But actually, when you look at that list, you think, how important is it for our young people to have a good grasp and be well informed on these issues so that they can make informed choices in life? I think it's so significant. So healthy intimate relationships. You're building here in this aspect of the curriculum on respectful relationships, in terms of friendships and mutual respect and trust and consent and loyalty. And it's about explaining that intimate relationships, like other positive relationships, can support our mental well-being. I guess it's highlighting the positive impact that when a human being is ready, the benefits that an intimate relationship can have for an individual. And it's then also important, again, thinking about our thematic links when we are teaching this curriculum, how we relate it to being safe, for example. these topics aren't taught in isolation, but they're tied together because one quite clearly relates to the other. The link from the statutory guidance is that students know how to recognise the characteristics and positive aspects of healthy one-to-one intimate relationships, which include mutual consent, respect, loyalty, trust, shared interests and outlook, sex and friendship. Right? And so I think it's really significant that we tie those things together. It's also significant that we teach that there's a diversity of intimate relationships, that as human beings, as young people, they have choice, whether that's thinking about the nature of relationships, so same sex, opposite sex, non-binary relationships, or it might be those who share different values and different cultural beliefs being in a relationship. It might be those who choose to be in a long-term committed relationship without being married. It might be having children, not having children, that actually within the context of intimate relationships, there is a wide range of diverse ways to engage in healthy intimate relationships. And I think it's important that students don't see this as a narrow part of the curriculum, but they, I guess, have permission to make their own informed choices about the types of intimate relationships they might pursue when they are ready. And I guess as part of that as well, sorry, I nearly missed off there, the idea of singleness is a perfectly appropriate choice for human beings. As part of that as well is teaching good communication, how, you know, the relationships are not romanticized completely, that actually they can be challenging, and that communication is a key part of ensuring relationships stay healthy. And then it is discussing, so we've understood exactly what healthy relationships are, the diversity of relationships, and then being really, I guess, explicit with young people about teaching about sex in intimate relationships. That it's perfectly normal to choose to delay having sex with a partner or to enjoy intimacy without sex. In a healthy relationship, people can discuss how they feel about sex without feeling pressured, intimidated or ashamed. And again, there's real clear links here with consent and making informed choice. Also, if someone is not ready in a relationship to talk about sex, that should also be respected. It's just as natural for someone to experience sexual feelings as it is to not. And I think again, it comes back to that idea of teaching young people, our students, that they are empowered, really important word, to make their own informed choices about the sexual relationships they choose to have, or importantly, not choose to have. So again, we've kind of talked about that already, but the idea that choosing not to have sex is a perfectly normal and appropriate response for some people in light of intimate relationships. It doesn't mean that you don't love the person or you can't have an intimate relationship without having sex. So again, and it's being really explicit with young people so that they understand, I guess, the diversity within an intimate relationship, that there are ways to engage intimately with someone without having sex, holding hands, hobbies, sharing experiences, etc. And also for those who are engaged in a, or will choose to be engaged in a sexual relationship, it's understanding that's not the only way to show intimacy. Again, really important to broaden young people's horizons on the nature of an intimate relationship. And then finally, it's thinking about when relationships end, the reasons for that. Sometimes it doesn't have to be a toxic reason or because the relationship is particularly unhealthy, but it's considering I guess the role breaking up plays for people and the impact that has, and what support they can seek when people do break up. Okay, moving on with one down in about 5 or 6 minutes. We're doing well. Again, these slides will be shared with you. I know I'm whizzing through quite quickly, but hopefully it's helpful just getting us thinking about, I guess, the breadth of what we need and the depth of what we need to cover to ensure our students are prepared for life in the wider world. So sexual consent and the law, and this ties into the unit of work in the statutory requirements on being safe. So really important, and I'm sure a few years ago it was very popular, wasn't it? The the consent lesson that used a cup of tea to explain it, and I think it was really popular because it was relatable, and I guess it took the stigma and the pressure out of it. But teaching consent is really, really important. So the age of sexual consent in the UK is 16, applies to all people and all sexual activity, and the law aims to protect the rights and interests of children and young people. It also makes it easy to prosecute those who pressure others into sex. So it makes it really clear, and I know you know this, that any sexual activity with a child under 16 is an offence, and consensual sexual activity in two people aged 16 or over is legal. So it's just ensuring that young people understand the law when it comes to intimate relationships. And then once they understand the law, it's then about thinking about the capacity to consent. So it says to be sexual consent, both of the following must apply. The person seeking consent must have taken reasonable steps to gain that consent, and the other person must have freedom to consent. Okay, and this is important for young people, I guess, in understanding exactly what consent means. So it's then also, and you know, it might be again worth using examples from the media about the idea that actually sometimes consent isn't possible, and to remind people that sexual activity with someone who does not have both capacity and freedom is a criminal offence. I guess it's just broadening students' horizons of what consent is, and that it is far more than just someone saying yes or no. And then it's, you know, it's just, I guess, covering all bases in terms of understanding consent, that if someone does not say no, it isn't the same as saying yes. And it's just ensuring exactly what young people know exactly what consent is. And the link in the statutory guidance is to know how to recognise the characteristics and positive aspects of one-to-one intimate relationships, which include consent, loyalty, trust. So this covers so many other areas in terms of thinking about trust and respect and healthy relationships. Okay, so there's extra, I guess, legal protection for young people. It's against the law for a person aged 18 or over to have any sexual activity with a person under the age of 18 because of the role. And if the person is in a position of trust, it's significant, and it's important that we teach young people this, so they're aware of the full law when it comes to sexual relationships. Okay, moving on, identifying and managing sexual pressure. So we need to teach pupils to identify sexual pressure in sexual decision making. So, you know, for example, making our decisions based on what others are doing. So that might be peers, celebrities, the impact and the pressure from pornography. Might be what others tell them to do. So partners, friends, family, social expectations, or emotional or psychological pressure. It's really important that, and again, this ties in with consent, doesn't it? That if they're being pressurized and they don't truly have consent. So I think, you know, expanding on those three elements of sexual pressure is really important, that students can see the impact that pornography can have in pressurizing people into certain sexual relationships, or the pressure from friends or peers or the media. I think really expanding on that and helping people, I guess, see the impact of pressure in sexual relationships. And then it's about recognizing sexual pressure, so explaining, I guess, the opposite, that in respectful relationship, positives are not used to pressure someone to having sex, so you know, pleasure or attraction. Threats are not used to bully or manipulate someone into having sex. Consent cannot be assumed and is always necessary. Just because you've had an intimate relationship with that person in the past does not assume that they would consent to that now. And sex shouldn't be expected because, like I just said, people have sex before. And consent to one type of sexual activity does not mean there is consent to other activities. I think really what I glean from this, for me, is just making sure we're really explicit in our teaching in sexual relationships to ensure that students have all the information and are informed to make their own choices. Again, managing sexual pressure, we need to teach young people and students that it's wrong and sometimes illegal for anyone to sexually pressure or control someone else. And we need to, again, signpost students and give them permission to share if they know this is happening, either for themselves or a friend or someone they know, to speak to someone they trust, speak to someone, a person in position of authority at school, whether that's a school nurse or someone in a pastoral position. Or finally, if it's important then to sometimes imagine that maybe that student doesn't feel comfortable telling someone they know, so we need to signpost to places like Childline or a GP or a doctor to ensure that they have all the avenues available to them to raise this and get it dealt with. And then it's about, we considered what sexual pressure is, and then ensuring that we teach pupils to recognise when others are feeling pressured, and that people do not always resist by saying no. Other ways people may indicate they do not consent include delaying, I guess awkwardly smiling or laughing or giggling rather than answering it directly, trying to change the subject, making excuses. And I think we want to empower our students to identify those signs so that they won't find themselves in a position of, I guess, pressurizing someone into a sexual relationship without being aware of it. Okay, sexual relationships. We need to teach that sex can play a role in loving relationships between adults. We need to explain that choices people make about sex can positively and negatively affect physical, emotional, mental, sexual, and reproductive health. It's really important that we raise awareness with our students that, I guess, the role that intimate relationships play in life, and that can be both positive and negative. And there's some potential positives and negatives there on the board. And it's important that we teach there is a link between future sexual health and someone's first sexual experience. Future sexual health tends to be better when the following applies to a person's first experience of sex: the willingness of both partners to have sex, so consent, not reacting to peer pressure or being under the influence, and using reliable contraception. I think it's really significant for young people. We want to, as I've already said, intimate relationships play such a key part in our health and well-being and our lives, and we want to equip young people with all of the evidence to make positive choices in their sexual and intimate relationships. We need to teach about sexual health screening, that is a way to check if they have STIs, and it's a way for them to protect their own health and that of any intimate partners they may have, can get tested through a GP. And also it's important, again, linking, we're going to look at a sexually transmitted infection in a minute, but they can exist without noticeable symptoms. It's important that we link, again, our learning on alcohol and drugs to sex, and identify that it makes it harder to make good decisions. Alcohol and drugs can cloud thinking, lower inhibitions, and lead to risky behavior, which may be regretted in the future, which may lead them or to pressure or to be pressured into a sexual relationship, which they later regret. It's really important, as part of this, we expand on the increased risk associated with alcohol and drugs. So that idea of regret and anxiety and unfaithfulness, so that students are aware when making choices. Okay, human fertility and reproduction, close links here with the science curriculum. And I know work with some schools who just can't fit the new statutory requirements into their PSHE education. And so they're working with the science department at their school to ensure that it's covered effectively there. And then they can say they've met the requirements in that aspect. And so it's really important we consider the role of the whole school in these things. So ensure pupils understand that although many important changes happen during puberty, this does not mean that an individual is physically or emotionally ready to have sex or able to consent. And this is tied in closely with the changing adolescent body aspect of the new requirements. So building on knowledge of reproduction, it's important that we teach during puberty, the ovaries develop and release eggs and periods start, usually between the ages of 10 to 16, although this can vary. And that testicles start producing sperm usually from age 10 to 14. And if we get there, at the end of this, I'm going to talk about good practice. And one aspect of good practice is to use accurate and scientific language when discussing sexual health and intimate relationships. It's really important that we give students the language to use that is both professional and accurate. And it's important that we explain that sperm can fertilize an egg through sexual intercourse, and this can result in pregnancy. We need to teach people that there are different ways that people, including LGBT people, can have a child, including donor insemination, co-parenting, adoption or fostering, surrogacy, and it's important again that we refer to NHS guidance here for detailed paths to parenthood. And then it's about teaching, you know, just showing the link here between the different aspects of the new statutory requirements, that lifestyle, a healthy lifestyle and health factors can reduce fertility. So drinking alcohol, smoking, using drugs, STIs, taking medication, weight issues, etc., etc. And just, I guess, teaching young people really explicitly that fertility problems are really normal. And that can happen without any reason or health issue as well. We need to teach people that getting pregnant later in life can be more difficult because of reproductive health, because reproductive health reduces with age, and teaching the science on this. Again, it might well be covered in science, and it's that conversation, it's that working together, but it's about teaching the facts and the science behind the reproductive system. We need to, in light of pregnancy, embed facts of reproduction from the science teaching and explain that pregnancy happens when a fertilized egg implants in the uterus lining. We need to teach that although pregnancy is more likely at certain times, it is possible to get pregnant at any time in the menstrual cycle, including during a period. And as at this point, I think it's really significant that we, I guess, dispel and debunk myths that might happen, that, you know, you can't get pregnant if you have sex in certain positions, or use the withdrawal method, or a woman's on her period. And so it's really important that as part of this, we're really highlighting the crucial role contraception plays in intimate relationships. Okay, and then it's thinking about pregnancy signs and symptoms with our young people. Again, just highlighting how important it is that we teach this topic thoroughly and with detail and with expertise, so that students have all the knowledge they need to make those informed decisions. We need to teach pupils that a normal pregnancy lasts 40 weeks. There are different ways for babies to be born, and that lifestyle during pregnancy affects the health of the fetus. And then it's about thinking, you know, well-being during and after pregnancy, and the impact that having a baby has. And as part of our teaching on fertility and pregnancy, it's important that we teach on miscarriage and stillbirth. Again, can be quite a traumatic topic to cover, but really important as we teach all aspects of intimate relationships. Okay, pregnancy choices and support. So we need to inform students of the legal choices they can make in relation to pregnancy, so considering adoption or fostering, or termination or abortion. And it's important that we teach the law when it comes to that. So when you teach the law, the Abortion Act 1967, and obviously further amendments, states that an abortion must be approved by 2 medical practitioners, carried out in an NHS hospital, or an established approved by government. These requirements do not apply when a registered medical practitioner is of the opinion that abortion is immediately necessary to save the life or prevent permanent injury or mental health of the pregnant woman. We need to explain, again, it's just informing our young people of the whole picture of the law, that abortions are allowed up to the 24th week of pregnancy if it's a risk, or it's riskier for the woman to continue with the pregnancy rather than have an abortion. In some circumstances, like we've mentioned, abortion is allowed after 24 weeks to prevent, you know, injury or potentially death, or if there's substantial risk to the child if they were born. It's important that we signpost again to support that's available if considering abortion, and that students have the access to make informed choices for themselves, to get the medical and emotional support they might need, and to ensure that we suggest non-judgmental local and national organisations who can give that support. Okay, STIs, we're working very quickly. We might just get there. We need to teach that there are different STIs and explain that they can be transmitted through various ways, and ensure that people understand that transmission of an STI can happen during different types of sexual activity. Again, a real key part for me of teaching sexual health and intimate relationships is, I guess, debunking myths and assumptions, for want of a better word, ignorance when it comes to sexual health and sexual relationships, so pupils have a well-informed, well-rounded understanding. Other ways STIs can be transmitted are the following: skin-to-skin, childbirth, breastfeeding, sharing bedding and clothes. As part of STIs, we need to teach about safer sex, keeping bodily fluids separate, using a barrier method of contraception. And again, as part of good practice, it's really significant that as practitioners, we are teaching students how to use condoms, and using correct anatomy when we do that, and ensuring that they understand exactly why condoms are appropriate and how to use them. Then we need to talk about the impact of STIs, and I think, again, thinking about good practice, I don't think it's appropriate to use imagery when it comes to STIs, because it can be damaging and not always accurate. And also, often the images that are shown are the haunting ones, and not all symptoms are like that, but can still have a profound negative impact. And then, as part of that, it's important that we teach about the, I guess, most common STIs, and to spot the symptoms and signs, and when to get help and testing. Okay, contraception and sexual health advice. In fact, what I'm going to do, I'm just aware of time, and so I'm just going to stop sharing for a moment. There's a heck of a lot in here, and I'm going to just take us past the last section there, so that I can get to a little bit of good practice. So I'm only skipping the last one. We're doing well. Okay, last little bit from me then. And I know it's been a lot of information. Okay, good practice. So examples of good practice. I'm just going to whiz through a couple of ideas for us when it comes to thinking about how we deliver our curriculum when it comes to sexual health and intimate relationships. So just a few ideas you might consider. So ensure the content is taught at the right time. So we've given students the knowledge they need to make informed decisions at appropriate ages. When we're thinking about LGBT content, it's really important that we consider its impact across the whole curriculum and the language we use, and how it might affect particular students at our school. It's really important we don't use photographic images relating to STIs. They can be distressing, and they can mislead about the symptoms. The NHS website provides useful information on symptoms if specific information is needed in your practice. I think it's important in our teaching of this subject that we avoid segregating by sex. I think it's significant that boys understand the different pressures on girls, and girls understand different pressures on boys, and that they learn in the same environment, unless there is a clear rationale for that. We need to ensure that there's space for students to ask teachers questions in safe, smaller groups where possible. We need to use medically correct language to describe human anatomy when we are teaching PSHE, sexual health and intimate relationships. And we need to give pupils opportunities to handle relevant objects, okay, and to ask questions about them, and to ensure that they are informed on them. I've already talked about this, but ensuring we use good practice when demonstrating condoms, and we use purpose-designed condom demonstrator rather than other props, which can be misleading and I guess create a jovial atmosphere when considering these I guess really important practice. Finally, it's really important that students are aware of where they can go for further support, both within the school community and beyond. So health professionals, GP, Childline, etc. And we're going to talk briefly about handling difficult questions in terms of good practice, but we probably are running out of time. But when it comes to difficult questions, there's some reasons why students ask them. So it might be to get information, it might be to seek permission, it might be to shock or to get a laugh, or to share their personal beliefs. And I think it's really important as professionals, particularly equipping non-specialists, that there isn't a pressure to answer straight away, that we don't ever need to use or shouldn't use personal information, and we should always anonymize. And it's perfectly acceptable to say, I'm going to ask and get back to you, or I'm going to research that. And I think that's a really key part when dealing with difficult questions. We've got right to the end. We're not going to do this final breakout room because there's 1 minute until it's finished, and I totally appreciate that teachers and educators are pressured for time, and the last thing I want to do is go over. I hope that has been useful for you. I also know I've gone through it in a really, really quick way, and so I'm going to leave that there. And if you have any questions, you are more than welcome to stick around for 5 or so minutes to ask me. All I would ask as we think about wrapping up is, could you please fill in the evaluation form that I've put in the chat? I'm asked to do it by Leader Quate. It's just helpful for them and the DfE for gathering evidence on the impact of these briefings. So if you don't mind, it's only a few questions, it won't take you long. So if you could just follow that link and complete that now, otherwise you'll probably forget like I will, and then you are free to go. But if you do have any questions, you want to stick around, please feel free to jump in now or message me on the chat, or if you'd prefer to email and I can support later in the week or whenever, then that's fine as well. But I do appreciate your engagement and you listening. I know it's a lot of information. I'll ensure that these slides and briefings make their way to you so you can use for your own practice and your staffs. Thank you for listening and joining. Yeah, cheers. You're free to go once you've done the evaluation.